In today's video, we will discuss some of the random, frequently asked questions in pharmacology, theory and practical examinations. So make sure to watch the video till end. Let's begin with the rationale of using digoxin in atrial fibrillation. Atrial fibrillation is an irregular and rapid heart rate that increases risk of strokes. It is caused due to high blood pressure or heart attack. Digoxin is used to control ventricular rate in atrial fibrillation. It reduces the ventricular rate in a dose-dependent manner by decreasing the number of impulses that pass down the AV node and bundle of His. Coming to the next question, rationale of using salbutamol in bronchial asthma. Salbutamol is a highly selective beta-2 agonist. It produces bronchodilation within 5 minutes and its duration of action is up to 2 to 4 hours. It is used to terminate asthma attacks. Muscle tremors, palpitation and restlessness are its side effects. Hyperkalemia is a common complication. Neostigmine is used to treat diaphragmatic paralysis due to D-tubocurarine. Why? D-tubocurarine causes ganglion blocking and leads to long duration of respiratory paralysis that needs pharmacological reversal. Anticholinesterases like neostigmine reverse the action of competitive blockers. Thus, neostigmine 0.5 to 2 mg is given subcutaneously to reverse the action of ganglionic blockade caused by D-tubocurarine and helps in treatment of diaphragmatic paralysis. Let us now see the rationale of using metoclopramide in vomiting. Metoclopramide is an effective and popular antiemetic drug for many types of vomiting. It is used as prophylaxis and treatment of vomiting, which is induced by emetogenic anti-cancer drugs like cisplatin. Metoclopramide is a gastric hurrying agent that increases gastric peristalsis and lower esophageal tone, which leads to suppression of gastroesophageal reflux and prevents vomiting. Vitamin C is given with iron in treatment of anemia. Vitamin C helps the body to absorb non-heme iron by binding to it, increasing the stability and solubility of iron. This helps in absorption of iron through mucous membrane of intestine. Thus, vitamin C is given along with iron in case of anemia. Let us see the adverse effects of rifampicin. One of the major effects of rifampicin is hepatitis. It occurs in patients with pre-existing liver diseases. In case of jaundice, the usage of drug is discontinued. Cutaneous syndrome, flushing, pruritus and rashes with redness and watering of eyes occurs. Flu syndrome, it is associated with chills, fever, headache, malaise and bone pain. Abdominal syndrome includes nausea, vomiting and abdominal cramps. Urine and secretions become orange-red color with use of rifampicin. Antiseptics used in dental practice. As far as antiseptics are considered, chlorhexidine is the first choice, followed by Listerine, Povidone and iodine. 0.12 to 0.2% of chlorhexidine oral rinse is highly active in preventing or treating gingivitis. Iodine is one of the oldest antiseptics and has a broad spectrum of activity. It is a powerful bactericidal, sporicidal and fungicidal agent. Let us see about the chelating agents. Chelating agents are drugs with complex metallic ions forming ring structures. They are primarily used in the treatment of heavy metal poisonings. Some of the chelating agents are dimercaprol. It is used as an antidote of arsenical war gas lewisite. Disodium edetate. It is the disodium salt of ethylene diamine tetraacetic acid. It is used for emergency control of hypercalcemia. Penicillamine. It is dimethylcysteine obtained as a degradation product of penicillin. It is used for patients with heavy metal toxicity like copper, mercury, lead, and zinc. Deferoxamine. It is obtained from a long chain of iron-containing complex from actinomycetes. It has high affinity for iron. 1 gram of deferoxamine is capable of chelating 85 grams of elemental iron. Hence, it is used in acute iron poisoning. So these are some of the random and most frequently asked questions in pharmacology. So make sure you revise them before your exam.